In the name of Allah, the most beneficent, the most merciful. Assalamu alaikum. I am Maryam Batul, a student of MS in Healthcare Management, and I intend to present on the topic Sindh Institute of Urology and Transplantation, which has been assigned to me by Dr. Naseem Ilyas. First of all, what is SIUT? The Sindh Institute of Urology and Transplantation, SIUT, is regarded as one of the premier institutes in the world that provides free of cost treatment of urological and nephrological ailments, where urological ailments include urinary tract infections, kidney stones, bladder control problems, and prostate problems, among others. Nephrological ailments include blood or protein in urine, chronic kidney disease, kidney infections, kidney swelling due to glomerulonephritis or interstitial nephritis, kidney cancer, polycystic kidney disease, hemolytic uremic syndrome, and kidney stones as mentioned in the urological ailments. Oncological treatments, where the field of oncology has three major areas: medical, surgical, and radiation. Treatments of hepatic and gastrointestinal diseases, where hepatic diseases are liver diseases and gastrointestinal diseases refer to diseases involving the gastrointestinal tract. Then, organ transplantation facilities to the general public. Next, the mission of SIUT is to provide the best healthcare without discrimination. Healthcare service delivery should be of highest quality and provided free of cost with respect and dignity, which covers to ensure quality healthcare as a fundamental right of every individual, provide free state-of-the-art medical cover without discrimination, treat all patients with dignity and utmost respect, free medical care and not to turn away any patient due to financial constraints, opposed to commercialization of medical treatment, create public awareness in the society at large for prevention of diseases, carry out research and transfer of technology for better medical care, enhance the capacity building of medical professionals, transfer of technology and expertise in various medical disciplines. Next, the vision of SIUT is healthcare for all, with dignity and compassion. Access to quality healthcare with dignity and compassion is a fundamental right. Moving towards the history of SIUT, 4 decades ago, SIUT started its journey as an 8-bed ward and burns unit of Civil Hospital Karachi. Gradually, the small ward expanded its activities clinically and physically. In 1991, it was granted the status of an institute by an act of the Sindh Assembly. In 2005, SIUT Trust was created as a charitable trust for the benefit of the public, aiming to provide medical facilities and financial assistance to those who are at the end stage of renal ailments. The location of SIUT is in the vicinity of Civil Hospital of Karachi, with its hub of activities taking place at Dewan Farooq Medical Complex, named after a generous philanthropist whose donation helped build the complex. In recent years, SIUT has further expanded its facilities after receiving another generous donation from a philanthropist, enabling the establishment of the Hanifa Suleiman Dawood Oncology Center. The building of the Oncology Center is another milestone for SIUT, facilitating the treatment of various cancers, including bladder cancer, kidney cancer, prostate cancer, adrenal cancer, testicular cancer, and post-transplant malignancies. SIUT opened its doors to patients in 1970 as the Department of Urology at Civil Hospital, Karachi. The first service offered by SIUT is dialysis. The kidneys are responsible for filtering waste products from the blood. Dialysis is a procedure that is a substitute for many of the normal functions of the kidneys. The kidneys are 2 organs located on either side in the back of the abdominal cavity. Dialysis can allow individuals to live productive and useful lives, even though their kidneys no longer work adequately. SIUT performs on average 1,000 dialysis sessions per day. The institute has state-of-the-art machinery and skilled technicians that perform dialysis on patients each day. Over 394,504 patients got their dialysis performed at SIUT in 2019. The rapid increase in kidney diseases and end-stage renal failure has also enhanced the number of dialysis patients that travel to SIUT each day. The second service offered is transplantation. Patients suffering from acute renal failure can be best treated by transplantation. The transplantation, in case of organ failure, is of two types. The living donor. After tissue typing and pre-transplant checkups of both the donor and recipient, the donor has to be a family member to donate organs. Deceased donor. In case of brain death, if the patient on the ventilator has pledged to donate organs, then with permission of the family members, the patient's organs are transplanted to a recipient. There are thousands of people waiting for a deceased organ in Pakistan. One pledge can save up to 8 lives. SIUT is a pioneer institution for introducing transplant technology in the country. SIUT has successfully performed over 5,500 transplants, with all the transplant patients being served medicines, post-checkups, dietary charts, and surveillance. The third service offered is outpatient. The outpatient clinic at the SIUT is designed to function as a multidisciplinary clinic where cases are jointly seen by a surgeon, physician, radiologist, infectious disease consultant, dietitian, and medical social officer. The clinic has the facilities for laboratory investigations and ultrasound image, including uroflowmetry. The outpatient also houses a medical record room where the files have been catalogued since 1971. An excellent retrieval system allows files to be made available as and when required. The patients are seen on first-come, first-served basis. The outpatient clinic includes stone clinic, adult nephrotic clinic, gastrointestinal clinic, post-transplant, PIDS nephrotic, pre-transplant, stricture, pediatric urology, prostate, infectious diseases, renal failure, donor follow-up clinic, general urology. The fourth service offered is inpatient. The inpatient service of SIUT comprises of 750 beds which are allocated to transplant pediatric and adult urological patients. These patients are kept in pre-operative and post-operative wards. Currently, patients at SIUT benefit from a number of inpatient services. The fifth service offered is emergency. The emergency at SIUT is working since the start of the institute, which is a 24-hour service. There are both urologists and nephrologists working here. SIUT provides several emergency treatments from oxygen support to intravenous fluids and emergency drugs. All these supported treatments are given to patients until they are stabilized. Once this is achieved and appropriate diagnosis has been made, the patients are sent to different departments such as the urology and nephrology wards. Patients who do not need to be sent to other departments are sent home and followed up through outpatient clinics. SIUT attends to more than 400 patients in one day. There are 68 beds, oxygen support points, and monitors within the emergency room. Patients who require emergency dialysis treatment are promptly transferred to the nephrology ward that has a special emergency dialysis unit. The sixth service offered is the unit laboratory. It is one of the fastest growing academic medical laboratories in Karachi, focused on clinical services, teaching, and research. Its state-of-the-art technologies deliver best diagnostics to patients, delivering excellence from facility and team to diagnosis and collaborations with innovative partners. The focus is patient safety and their highest priority is quality. Their 5 ancillary diagnostic laboratories include chemical pathology, Haematology and Blood Bank, Histopathology, Microbiology, Immunology and Molecular Biology. The seventh service offered is radiology. At SIUT, radiology services started in 1980 with a mobile X-ray unit. Earlier, X-ray services were provided by the Radiology Department of the Civil Hospital Karachi. Later, an ultrasound machine was added. The Department of Radiology was established at SIUT in 1993. Today, SIUT has a well-equipped radiology department offering the following facilities: CT scan, X-ray, color Doppler imaging, ultrasonography, MRI, angiography, nuclear medicine. The eighth service offered is the Department of Ophthalmology. Ophthalmic problems are very common in patients visiting SIUT for their systemic issues. This was much realized and required after organ transplantation was started at this esteemed institute. Patients experienced more visual problems as their lives were prolonging and secondary to many of the immune suppressants prescribed, which were inevitable in order to save their lives. In the month of November 2012, this department started working with one senior ophthalmologist. As it was expected, the department needed to grow. So, another consultant ophthalmologist joined on daily basis with an assistant medical social officer. The ninth service offered is the operation theaters. There are 23 operation theaters in SIUT. They are well equipped with state-of-the-art facilities in accordance with high standards of hygiene and asepsis. A wide range of surgical procedures are performed. The 10th service offered is the Department of Nutrition and Dietetics. The Department of Nutrition and Dietetics started its services in 1993. Its responsibility is to assess, diagnose, and plan. Each year, over 100,000 patients are consulted by the Department of Nutrition. The department is also involved in nutrition-related research and conducts nutrition education programs for medical personnel and students of the School of Nursing and Zainul Abidin School of Medical Technology at the SIUT. Since majority of patients coming to SIUT are ignorant about the dietary requirement, this department prescribes therapeutic drugs aimed at improving patients' clinical outcomes, such as better potassium and phosphorus control in chronic kidney disease and avoidance of metabolic complications in post-transplant patients. Imparting education to the patient is an important activity at the department. The department has published nutrition information handouts based on current international guidelines, while at the same time taking into account the socio-cultural aspects of our patient population. The nutritional information handouts are pictorial and easy to understand so as to aid patients who cannot read. The 11th service offered is medical social services. The need to establish a patient's welfare department was first felt in SIUT when the transplant program initiated towards the end of 1985. A team of social welfare officers was already working to look after the dialysis patients, who often faced issues about social, psychological, and family issues. A full-fledged patients' welfare department was established in SIUT in April 1986. Social welfare officers who were associated with SIUT strengthened the newly established team. The team, which works with the clinical staff, helps the patient on a variety of social, economic, and professional issues, which are often confronted by both dialysis as well as transplant patients. They provide emotional support to patients and guide them by carrying out supportive counseling. The SIUT is an independent private degree awarding institution recognized by the Higher Education Commission of Pakistan. The education at SIUT firstly includes medical education. There are training programs in urology, nephrology, and transplantation. SIUT prepares doctors for fellowships and memberships of the College of Physicians and Surgeons of Pakistan and offers research-based degrees. MS or MD in Urology and Nephrology, MPhil and PhD in the basic biomedical sciences. Research is an intrinsic part of education in medicine and constitutes an important element of the studies. Secondly, the Center of Biomedical Ethics and Culture is the first center in Pakistan and was inaugurated in 2004 to educate healthcare professionals and others in the field of biomedical ethics. The center now offers a one-year postgraduate diploma in biomedical ethics and a two-year master's in bioethics program. In addition to the two formal academic programs, the center also conducts periodic short courses and public interest programs, not only at its premises at SIUT, but also upon invitation across the country in different academic institutions. Thirdly, it includes Zainul Abidin School of Medical Technology. Its objective is to produce highly motivated and skilled professionals who can prove an asset to any organization they choose to work. It offers a 4-year BS program with in-house and hands-on training in various disciplines. Plans are underway to develop a career enhancement program. The degree is awarded by Sindh Institute of Medical Sciences, which is recognized by HEC Pakistan. Fourthly, it includes School of Nursing. SIUT established the School of Nursing in 2006. SIUT is the first leading teaching learning hospital which is currently providing free of cost education in Diploma Nursing Program and 6 months Nursing Assistance Program. After its progress, it upgraded its nursing training by starting General Nursing Diploma Program in 2007, which qualifies students to take the licensure exam of Sindh Nurses Examination Board. This enables the graduates to practice as qualified registered nurses in Pakistan. SIUT is strongly committed for the professional upliftment of nursing profession and considers the profession as an inseparable segment of healthcare, which looks after individuals, families, groups, and communities. Research. The Center for Human Genetics and Molecular Medicine was established at the SIUT in 2008. It conducts research in the human genome with applications in the etiology of renal diseases related to cancer, genetics, transplantation, and allograft survival. The milestones and achievements of SIUT are Pakistan's first cadaver organ transplant. Doctors and paramedics of SIUT created a medical history by carrying out Pakistan's first cadaver kidney transplant in 1995. The organ, gifted by Eurotransplant Foundation, was retrieved from a 14-year-old Dutch girl who died of cerebral hemorrhage. Her kidney was successfully transplanted into a 24-year-old Pakistani female patient suffering from end stage of renal failure. Next, first locally harvested cadaver organ transplant. It took place in October 1998 when a 24-year-old Pakistani met a serious road accident. The family approached the SIUT with their decision to honor the deceased's wish to give the gift of life of his organs, kidneys, and eyes. The kidney recipients were 2 young men, while his corneas restored the vision of 2 others. Next, first successful liver transplant. It took place in November 2003. The surgical procedure was carried out after developing an extensive liver transplantation program. A 6-month-old baby was transplanted a liver in collaboration with King's College Hospital, London. Another milestone is that in 2017, SIUT had performed a total of 5,500 transplants of kidney, cornea, and liver. Next, The country's first clinical transplant immunology laboratory was inaugurated at SIUT to bring advancements in the fields of transplant sciences. Next, the first lithotripsy unit in the public sector. SIUT was a pioneer in the process of lithotripsy. The lithotripter was the first in the public sector hospital of Pakistan. The machine has helped successfully treat kidney diseases as a daycare procedure. Installation of first public sector PET CT scans. A positron emission tomography scan is an imaging test that allows your doctor to check for diseases in your body. SIUT acquired the first PET CT scan facility in the public sector. Thank you for watching. Stay blessed.